I'm here again with Dr. Hope. I'm Dr. Grace. Yes, and so we're going to talk today about this medication called levothyroxine. Um, how many of you have heard about levothyroxine? What is this medication called levothyroxine, and why is it special to us as endocrinologists? So the reason is because levothyroxine is a medication that we use to treat underactive thyroid. Our thyroid gland, which is located in the front of the neck, we have talked about it. If you want to know more about your thyroid gland, how would you know if you have underactive or hyperactive thyroid? We have the videos in our channel. Please watch and share with your friend. So this medication called levothyroxine is the medication, it's a hormonal medication that we use to replace your thyroid hormone when it is deficient, when you don't have enough of the thyroid hormone. We replace you with this medication. Probably because you have your body fighting against you, which is called autoimmune disease, or maybe your thyroid gland has been removed and your doctor had told you you have to be on the levothyroxine. Now, the medication can be called in some places tyrosine or unithyroid or synthroid, which is most common name that people know it for. So Dr. Hope is going to talk to us about why you need to take this levothyroxine on empty stomach. Why is it important?
Okay, so thank you, Dr. Grace. So levothyroxine is uh, poorly absorbed if taken with other foods and medications. Levothyroxine is absorbed in the small intestine, mostly in the jejunum and ileum. And so when it gets absorbed, it needs to be absorbed on its own, because if it's taken with other medications or foods, then it will decrease the absorption and you won't get the effective dose of the medication that's needed. So you should be taking levothyroxine not on a full stomach, but on an empty stomach. And how long after? Usually 30 to 60 minutes before a meal, actually. So it's best to take it before a meal, 30 to 60 minutes, or if you're taking it after, we recommend usually 3 hours after the meal. Um, so, what are the foods that can interact and cause decreased absorption of levothyroxine? So we usually take all our medications, usually with water, right? But some people in the morning, if you're taking levothyroxine early in the morning, some people get up and have their coffee first thing in the morning. But if you're taking levothyroxine, you can't even take it with caffeinated drinks. So you can't take levothyroxine with your coffee. It has to be with water because even the coffee and tea decrease the absorption of levothyroxine. Other foods that actually decrease absorption of levothyroxine include foods that are high in fiber, because again, fiber can significantly cause you to decrease the absorption of your food intake, and along with having increased bowel movements, it can also allow whatever is taken in to be removed before being absorbed, which includes the levothyroxine. Um, Foods that are high in calcium and iron, and actually calcium and iron pills themselves are affected with absorption of levothyroxine. So I'll talk more about that later. And Grace will tell us about some of the medications to avoid taking simultaneously with levothyroxine.
Yes. Yeah, that's very true because, we often want to take our pill with food because we have this belief system that when you don't take medication on empty stomach, you don't want to hurt yourself. You have to take food, you have to eat and take pill. No. For some medications such as this levothyroxine, you have to take it on empty stomach for it to be well absorbed. And like Dr. Hope mentions, if you are on some medications like calcium, or like you taking iron supplement, or probably you're pregnant and you're on prenatal vitamins. It has all this calcium and iron in it, so you don't want to take it together with the levothyroxine. Other medications include medications like the one for your stomach coating when you have stomach ulcer, like Protonix, which are omeprazole, pantoprazole, all those medications. You don't want to take them together with it. And we also have medication like sevelamer, or you are on oral medications to lose weight, like the Rybelsus. You don't want to take it together. Other one is the medication for your bone for osteoporosis, like if you're on Foxamax, you don't want to take it together as well. So all these medications has to be separated from your levothyroxine. Aside from you taking it on empty stomach, you also don't want to take these certain medications together with this pill. Otherwise, your medication will not work. So now, if you are not to take it together, how many hours apart should they separate this medication from each other?
Okay, thank you, Dr. Grace. So if you are on levothyroxine alone, if that's the only medication that you're taking, or the only medication that that it doesn't have other medications that will significantly interact with it, then I say take your levothyroxine early in the morning, 30 to 60 minutes before your meal, on an empty stomach, and drink it with water. No tea or coffee while you're taking the levothyroxine. So wait at least 30 to 60 minutes for that, before you eat. However, if let's say you have two medications that need to be taken on an empty stomach, such as the Rybelsus, um, or even something like Fosamax, I would say then you can take your levothyroxine in the evening, 3 hours after your meal, on an empty stomach, and then take that other medication such as Rybelsus, or even a bisphosphonate like Fosamax, in the morning. And again, follow the recommendations for those medications regarding when to eat as well, which includes 30 to 60 minutes after taking those medications. All right. Now, let's say if you're taking calcium and iron pills should be taken at least 3 to 4 hours apart from levothyroxine. This includes prenatal vitamins and even multivitamins that have calcium and iron in them. So do not take calcium and iron even an hour after, because the absorption can be decreased. So I would say take it 3 to 4 hours after the meal. And, and just use healthy tips in terms of eating healthy to begin with. So even when you do eat, you want to make sure you eat healthy. So as endocrinologists, we encourage that as well.
Yes.
All right,
Yes.
Dr. Grace.
All right. So I think for today, we've just to recap, your levothyroxine is the medication we use to take care of your thyroid, especially when you have underactive thyroid. It's basically synthetic hormone replacement medication, and you have to take it on empty stomach with water only, no coffee, no sugar, nothing, no milk. You take it on empty stomach. You wait 30 to 60 minutes apart before you eat. And if you are taking other medications that interact with it or that will prevent it from being absorbed, you have to wait, as Dr. Hope has mentioned, 4 hours apart. And if you have other medications that you have to take on empty stomach, two different medications that has to be taken on empty stomach. So you take one at night, you take the other one in the morning. And I hope you understand. If you have any question regarding this, feel free to share or ask your question. And yep.
Thank you. And thank you so much for joining us. And please don't forget to subscribe and follow us. We are on Instagram, Facebook, YouTube at Ask Endocrinologists. So we look forward to just joining you again for more tips on endocrinology related disorders, medications, and just staying healthy. And we really thank you for following us and joining us. And please subscribe to our channel so that we can keep you informed about great endocrinology tips. Thank you.
Thank you, and bye for now. Thank you for watching.